Heart Failure Patient Education Script. Title: Understanding Heart Failure, Causes, Symptoms, Treatment, and Hope. Hello, and welcome. Today, we're going to talk in detail about a very important medical condition that affects millions of people around the world: heart failure. Let's begin. Broken heart. What is heart failure? Heart failure, also called congestive heart failure, CHF, is a chronic condition in which the heart is unable to pump enough blood to meet the body's needs for oxygen and nutrients. Now, let me be very clear. Heart failure does not mean that the heart has stopped working completely. Instead, it means that the heart is weakened or stiff and can't pump blood as effectively as it should. There are two main types of heart failure. Heart failure with reduced ejection fraction, HFrEF, where the heart muscle becomes weak and can't pump well. Heart failure with preserved ejection fraction, HFpEF, where the heart muscle becomes stiff and doesn't fill properly. Warning: what causes heart failure? Heart failure is often the result of other diseases or conditions that damage the heart. These include coronary artery disease, CAD, when the arteries that supply blood to the heart become narrowed or blocked. High blood pressure, hypertension, which forces the heart to work harder over time, causing it to weaken. Heart attack, myocardial infarction, damage from a past heart attack can leave scar tissue, weakening the heart. Cardiomyopathy, disease of the heart muscle from genetic, viral, alcohol-related, or unknown causes. Valvular heart disease, when heart valves are narrowed or leaky. Arrhythmias, abnormal heart rhythms that can stress the heart. Diabetes, obesity, and sleep apnea also raise the risk of heart failure. Stethoscope. What are the symptoms? Heart failure symptoms can be subtle at first, but often worsen over time. Patients may experience shortness of breath, especially during activity or when lying flat. Fatigue and weakness, because less oxygen-rich blood reaches the muscles. Swelling, edema, especially in the legs, ankles, feet, or abdomen due to fluid buildup. Rapid or irregular heartbeat, as the heart struggles to maintain circulation. Persistent cough or wheezing, sometimes with pink, frothy sputum. Weight gain from fluid retention. Difficulty concentrating or decreased alertness. If any of these symptoms worsen suddenly, it may be a sign of acute decompensation, which requires urgent medical attention. Microscope. How is heart failure diagnosed? Diagnosis begins with a thorough medical history and physical examination, followed by tests such as echocardiogram, echo, to check heart function and ejection fraction. Electrocardiogram, ECG, to detect rhythm issues or prior heart attacks. Chest X-ray, to look for fluid in the lungs or an enlarged heart. Blood tests, including BNP or NT-proBNP levels to assess heart strain. Stress tests or cardiac catheterization if needed. Pill. How is heart failure treated? Although heart failure is a chronic condition, it can be managed with the right treatment plan. The goals are to relieve symptoms, improve quality of life, slow disease progression, and prevent hospitalization.
Here's how.
1. Lifestyle changes. Low-sodium diet, under 2 grams per day. Fluid restriction, especially if swelling or shortness of breath is present. Daily weight monitoring, to catch fluid buildup early. Regular exercise, under a doctor's guidance. Avoiding alcohol and smoking. 2. Medications. ACE inhibitors/ARBs/ARNIs, to lower blood pressure and reduce heart stress. Beta blockers, to slow the heart rate and improve function. Diuretics, water pills, to reduce fluid buildup. Aldosterone antagonists, to reduce symptoms and improve survival. SGLT2 inhibitors, a newer class shown to benefit heart failure patients, even those without diabetes. Digitalis, digoxin, in select cases to strengthen heart contractions. 3. Devices and procedures. Implantable cardioverter defibrillators, ICDs, for patients at risk of sudden cardiac death. Cardiac resynchronization therapy, CRT, to improve coordination of heartbeats. Ventricular assist devices, VADs, in severe cases. Heart transplant, as a last resort in end-stage heart failure. Emotional impact and support. Heart failure affects more than just the heart. It affects the mind and emotions too. Patients often feel fear, anxiety, or depression. But here's the good news. You are not alone. With a strong care team, support from loved ones, and commitment to your treatment plan, you can live a longer, fuller, and more active life. Final thoughts. Let me summarize. Heart failure is serious, but manageable. Early diagnosis, appropriate medical treatment, and lifestyle changes can significantly improve outcomes. Education, routine follow-up, and emotional support are essential. So if you or a loved one are facing heart failure, don't give up hope. Science, medicine, and the human spirit are stronger than ever. Let's face heart failure, not with fear, but with knowledge, care, and strength. Thank you for listening. Take care of your heart, and it will take care of you.